Wrong tube placement. Are you a student nurse? The doctor's voice rang out when he saw the dark-haired petite girl checking vital signs for patient 47. No name badge, no medical coat, just faded gray scrubs. But every movement she made was perfect to the precise beat. Until the head surgeon stopped completely, looked at the monitor display, then whispered quietly, "Wait, who exactly trained her to do that?" The entire operating room fell silent. Who was she really? Her name was Elena Markovich, 32 years old, Balkan descent with dark brown hair, always pulled back in a tight, practical bun. Small frame that moved with deliberate silence through the hospital corridors. She always wore a surgical mask that concealed most of her features. Elena worked night shifts in the emergency department at Fort Pierce Military Hospital. She wasn't a doctor. She didn't hold any current medical certification that appeared in official records. Her job description read simply, technical support in emergency environments. During critical emergency cases, Elena's duties were supposed to be basic: sterilize equipment, organize bandages, replace IV fluid bags, support work that required no medical expertise. The medical team didn't think she was particularly skilled. Some of the younger nurses had even given her a cruel nickname, Equipment Robot, but nobody noticed something important. Whenever Elena stepped near the vital signs monitors, the readings always stabilized. Heart rhythms that had been erratic would smooth out. Blood pressure measurements that had been inconsistent would suddenly show clear, reliable patterns. She never argued when doctors criticized her work, never defended herself when nurses made jokes. She just bowed her head and continued with her tasks. That night, during an emergency surgery for a paratrooper with pelvic fractures and fluid buildup in his lungs, Elena was assigned to monitor maintenance, a position nobody considered important. One of the attending nurses criticized her setup. "You've connected the monitoring leads incorrectly." But immediately afterward, the heart rhythm on the display screen stabilized in an unusual way, even though the patient's condition remained critical. The head surgeon, Colonel George Danton, looked up from his work. Who adjusted the vital sign system?" The small woman didn't speak. She just stood quietly, her eyes focused on the ventilator settings. But Colonel Danton had been practicing military medicine for 23 years. He'd worked in field hospitals where the difference between life and death often came down to someone knowing exactly how to read equipment that was failing under impossible conditions. And what he was seeing on the monitors suggested that someone in his operating room possessed knowledge that went far beyond basic technical support. The patient's vital signs weren't just stable, they were optimized. Heart rate, blood pressure, oxygen saturation, and ventilation rates were all maintaining levels that most experienced intensive care specialists would struggle to achieve. But the person responsible was standing quietly in the corner, wearing faded scrubs and no identification badge. Elena had learned to remain invisible during her previous career. She discovered that being underestimated was often an advantage, especially when working in environments where trust had to be earned through competence rather than credentials. She'd also learned that sometimes the most important medical interventions were the ones that nobody noticed. Small adjustments that prevented crises, subtle modifications that kept patients stable during procedures that pushed their bodies to the limit. These were skills that couldn't be taught in medical school because they required experience with situations that medical schools never simulated. Experience with treating trauma patients when proper equipment wasn't available. Experience with making life-saving decisions when communication systems failed. Experience with keeping people alive when the textbook solutions weren't enough. Elena had that experience. But explaining where she'd acquired it would require revealing things about her past that were better left unexamined. So she remained quiet, competent, and invisible until the night when her skills became too obvious to ignore. I once did clinical training in an ICU, where a 0.5 milliliters error in adrenaline could kill someone. But once I saw an old nurse freeze, just because someone adjusted a breathing tube with such precision, like they'd been practicing their whole life. I never forgot that look. exactly like Elena's eyes that night. After the surgery was completed, Colonel Danton ordered a comprehensive review of all monitoring data from the procedure. What he discovered defied explanation. The record showed evidence of vital sign interventions throughout 37 minutes of the operation, but the modifications hadn't come from the central monitoring system. They'd been made using auxiliary equipment near the operating table, equipment that most of the medical staff didn't even know how to operate. The nursing staff initially blamed sensor malfunctions for the unusual readings, but the results showed a level of stability that was remarkably rare for such a complex trauma case. The system had detected several specific interventions: manual adjustment of IV fluid pressure using hand-operated controls that bypassed digital systems, modification of fluid flow rates according to Y60 protocols that were only taught to battlefield medics with specialized training, micro-adjustments to ventilator settings using techniques that weren't part of standard hospital procedure. Colonel Danton stared at the data with growing unease. Only one military unit had ever trained personnel in those specific protocols, and that unit had been disbanded in 2017. When he asked the nursing staff about Elena's background, nobody had detailed records beyond a handwritten name: Elena M. Danton ordered a comprehensive personnel file search. The response that came back was both brief and unsettling. Records classified under military security protocols. That evening, Colonel Danton made a secure phone call to someone he hadn't spoken to in 5 years, the former director of the Battlefield Emergency Training Institute. "I need you to look at some medical data," Danton said, "and I need you to tell me if you recognize the techniques being used." 20 minutes later, his phone rang back. "George, where did you get this information?" "From a night shift technician at my hospital." "Why?" "Because these are Ghost Tactical Medic protocols. GTM was a classified program that trained medical specialists for deep infiltration operations. They worked in combat zones where conventional medical support wasn't available." Danton felt a chill run down his spine. What happened to that program? Disbanded after a security breach in 2017. Most of the operatives were reassigned or discharged, but there were rumors about one who was never officially accounted for. What kind of rumors? Someone with the code name Echo 9, a specialist who could stabilize trauma patients under fire using equipment that most doctors couldn't operate even in ideal conditions. The story said she could keep people alive in situations where survival should have been impossible. Colonel Danton looked at the personnel files scattered across his desk. What did Echo 9 look like? Nobody knew. She never removed her protective gear during operations, complete operational security. But as Danton reviewed the limited information he had about Elena, pieces began to fit together in ways that should have been impossible. The next night, a patient in intensive care went into anaphylactic shock when the hospital ran out of standard epinephrine. The attending physician was dealing with another emergency when the crisis began. Elena was restocking supplies in the ICU when the alarm started sounding. She didn't hesitate, didn't call for help, didn't wait for authorization. She walked directly to the medication cabinet, selected a vial that nobody else had thought to use, and administered an injection into a specific location on the patient's wrist, using a technique that wasn't taught in any nursing program. The patient's heart rate stabilized immediately. Dr. Sarah Chen, a resident who witnessed the intervention, stared at Elena in amazement. "Where did you learn that technique?" Elena looked at her with eyes that had seen too much to be easily explained. "I once had to do the same thing, when I had 4 minutes and no lights." The ICU fell completely silent, because what Elena had just demonstrated wasn't basic medical care. It was battlefield medicine practiced by someone who'd learned it in places where mistakes meant people died, and success meant everyone might live to see another day. Dr. Chen had read about techniques like the one Elena had just used, but only in classified military medical journals that describe procedures developed for special operations personnel. procedures that were taught to medics who might have to save lives while under enemy fire, in complete darkness, using equipment that was damaged or improvised. The kind of training that produced people who could keep someone alive when everything else failed. But Elena Markovich was supposed to be a technical support specialist with no advanced medical training. Word of the incident spread quickly through the night shift staff, not as gossip, but as the kind of respectful whisper that medical professionals use when they realize they've witnessed something extraordinary. Within 48 hours, 3 other incidents had occurred where Elena's interventions had prevented patient deaths during critical moments. Each time, she'd used techniques that weren't part of standard hospital protocols. Each time, she'd acted with the calm precision of someone who'd done these procedures many times before under much worse conditions. Colonel Danton knew he needed answers, but he also suspected that the answers would be more complicated than his hospital was prepared to handle, because Elena Markovich might not be who she appeared to be, and the skills she was displaying might have been acquired in places that didn't officially exist. I know some wartime medical records that were hidden away, not because of wrongdoing, but because they witnessed things that shouldn't be made public. There are techniques not found in textbooks. There are people who don't need the title doctor because their hands have already saved lives when there was no hope left. While running a routine system diagnostic, a hospital technician discovered something unusual in the metadata from Elena's recent patient interactions. Embedded in the digital records was an alphanumeric code, GTC 0099. The code meant nothing to the technician, but it triggered security protocols that immediately flagged the discovery for administrative review. Colonel Danton canceled all his scheduled meetings and made another secure phone call to his contact at the former Battlefield Emergency Training Institute. The response was immediate and shocking. That designation belonged to the Ghost Tactical Medic Program. GTM 0099 was the operational code for Echo 9. Tell me everything you know about Echo 9. She was a legend among special operations medical personnel, the only medic who could maintain patient stability during active combat without any external support. She once kept a wounded commander alive for 6 hours while surrounded by enemy forces, using nothing but field supplies and improvised equipment. Colonel Danton stared at the code displayed on his computer screen. What happened to her? After the Chechnya border incident in 2017, the entire Ghost Tactical Medic program was disbanded. Most operatives were reassigned to conventional medical roles, but Echo 9 was never officially processed. Why not? Because she'd never revealed her identity, even to her commanding officers. Complete operational security meant nobody knew her real name, her background, or even what she looked like without protective gear. The implications hit Colonel Danton like a physical blow. Elena Markovich might be Echo 9, one of the most skilled battlefield medics in military history, now working night shifts at his hospital under an assumed identity. But he needed confirmation. That evening, Colonel Danton waited until Elena's shift began, then approached her directly. "I need to ask you something," he said quietly. "Have you ever heard of Ghost Tactical Medic designation GTM 0099? Elena's entire body went still. For just a moment, the carefully maintained mask of anonymity slipped, revealing something underneath that confirmed his suspicions. "I'm not sure what you're referring to," she said carefully. But Colonel Danton had been reading people's responses to difficult questions for decades. Elena's reaction told him everything he needed to know. "Echo 9, he said simply. Elena looked at him for a long moment, then nodded slightly. That designation was retired in 2017. But the person who held it wasn't. The person who held it learned that some kinds of service are better performed without official recognition. Over the following hour, Elena revealed parts of her story that explained everything the hospital staff had witnessed. She'd been recruited for the Ghost Tactical Medic program because of her ability to remain calm under extreme pressure and her intuitive understanding of how human physiology responds to trauma. For 3 years, she'd operated in combat zones where traditional medical support was impossible. She'd treated wounded soldiers while under direct fire. She'd performed complex medical procedures in complete darkness. She kept people alive using equipment that was damaged, improvised, or completely inadequate for the situations she faced. I once performed emergency surgery using a knife sterilized with vodka and sutures made from parachute cord, she told Colonel Danton. The patient survived because I'd learned to work with whatever was available. Her specialty had been rapid stabilization of trauma patients during extraction operations. When Special Forces teams were wounded behind enemy lines, Echo 9 was the person who kept them alive until they could reach proper medical facilities. But the program had ended when their operational security was compromised. Several team members were captured or killed. Echo 9 had been in the field when the disbandment order came through. Instead of reporting for reassignment, she'd simply disappeared. "Why didn't you return to regular military service?" Colonel Danton asked. "Because I'd seen what happens when medical personnel become targets. When the enemy knows who you are, they hunt you specifically. I decided that I could serve more effectively by becoming invisible." For the past 8 years, Elena had worked in civilian hospitals under various identities, always in support roles that kept her skills hidden while allowing her to help patients who needed more than standard medical care could provide. "I don't treat people for recognition," she explained. "I treat them because they need someone who knows how to help when the textbook solutions aren't enough." Colonel Danton made a decision that would change how his hospital operated. "I want to offer you a position as a consulting specialist. Full medical privileges, access to advanced equipment, recognition for the skills you've been hiding." Elena shook her head. "I appreciate the offer, but I prefer to work quietly. People trust me more when they don't know what I'm capable of." "Then what can I do to support your work here?" "Let me continue what I'm doing, but when you encounter cases that seem hopeless, when standard protocols aren't working, when you need someone who's willing to try things that aren't in the manual, let me help." It was an arrangement that would save more lives than either of them realized. Within weeks, Elena had become the person that other medical staff consulted when facing impossible cases. Not officially, not through formal channels, but through the kind of informal network that develops among professionals who recognize genuine expertise. She remained a technical support specialist in the official records, but she became something much more important to the people who worked with her, the person who knew what to do when everything else failed. The hospital survival rates improved dramatically. Patient outcomes exceeded statistical predictions. Medical complications decreased across all departments, but most importantly, the medical staff began to understand that healing sometimes requires more than textbook knowledge. Sometimes it requires experience that can't be taught in medical school. Sometimes it requires someone who's learned to save lives when saving lives shouldn't be possible. Elena Markovich had become that person, not through formal training or official recognition, but through years of refusing to let people die when she might be able to prevent it. Type GTM 0099. If you believe some healers don't need diplomas on the wall, they just need steady hands and the knowledge that someone's life depends on getting it right. Colonel Danton called Elena into his office the next morning. His first question was direct. "Were you ever officially designated as Echo 9? Elena looked at him for several seconds, then shook her head. Echo 9 was a code name, not a person. But when Colonel Danton placed a faded military patch on his desk, one bearing the designation GTC 0099, Elena's expression changed. She reached out and touched the patch gently, then smiled for the first time since he'd known her. "This patch was once sewn onto my sleeve." The confirmation was quiet, but definitive. Elena Markovich was indeed the legendary Echo 9, the ghost tactical medic who'd saved lives in situations where survival should have been impossible. But Elena didn't ask for her rank back, didn't request official recognition or demand acknowledgement of her previous service. She made only one request: to continue working night shifts, where there were fewer people, less noise, and just machines and fragile lives that needed someone who understood both. From that day forward, all internal hospital records showed a small notation next to Elena Markovit's name: authorized, tactical support specialist, clearance 4/5 medical field operations. But to the outside world, she remained just a small woman in faded scrubs who wore a surgical mask and cleaned equipment. The change was subtle but significant. When difficult cases arose, when standard protocols weren't working, when patients seemed beyond help, the medical staff began quietly consulting Elena. Not through official channels or formal requests, but through the kind of respectful communication that develops between professionals who recognize genuine expertise. "Elena, could you take a look at this patient's vitals?" "Elena, we're having trouble with the ventilator settings. What do you think?" "Elena, the medication isn't working the way it should. Have you seen anything like this before?" She would review the cases with the same calm attention she'd always shown, then offer suggestions that came from experience treating trauma under conditions that most medical personnel never encountered. Her recommendations were always practical, always based on techniques that could be implemented immediately, and always focused on keeping patients stable until conventional treatment could take effect. The consulting role was unofficial, unpaid, and completely voluntary. Elena accepted no credit for positive outcomes and took no responsibility for decisions made by other medical staff. But her influence on patient care was undeniable. Dr. Sarah Chen, who'd witnessed Elena's intervention during the anaphylactic shock case, began incorporating techniques Elena had taught her into her own practice. Other residents and nurses did the same. The hospital developed a reputation for exceptional emergency care, particularly for trauma cases that other facilities considered too complex or too risky. Medical professionals from other hospitals began requesting transfers to Fort Pierce, drawn by stories of innovative treatment protocols and unusually high survival rates. But nobody outside the night shift staff knew that many of these improvements could be traced back to a woman in gray scrubs who worked quietly in the background. Elena preferred it that way. She'd learned that effective medical care often happened when patients and families could focus on healing rather than on the credentials of the people helping them. "The best medicine," she told Dr. Chen during one of their informal consultations, "is when the patient never has to know how close they came to dying." It was a philosophy that shaped how the entire night shift approached patient care. They became the team that handled the cases nobody else wanted to take, the emergencies that arrived when other departments were overwhelmed, the patients who needed more than standard protocols could provide. And at the center of it all was Elena, still cleaning equipment and adjusting monitors, still invisible to most people who passed through the hospital, still saving lives in ways that would never appear in any official report. Subscribe if you believe the most important medical care often happens when nobody's watching, provided by people who don't need recognition, just the knowledge that someone's life got better. Several months later, a soldier was brought in from Afghanistan, barely conscious from injuries so severe that the medical team initially assumed he wouldn't survive. Multiple trauma specialists examined the case and reached the same conclusion. The damage was too extensive for any meaningful intervention. The soldier's family was notified to prepare for the worst. When everyone else had given up, Elena was allowed into the room as part of what was essentially a final courtesy, someone to maintain basic monitoring while the family said their goodbyes. Elena didn't speak when she entered the room. She simply placed her hand on the soldier's chest and checked his pupil reflexes using techniques that weren't part of standard neurological assessment. Then she took a pen and wrote on the plastic bed chart, 0.3s pulse delay, reflex window still open. 15 minutes later, the soldier moved his fingers. It was the first voluntary movement he'd shown since arriving at the hospital, a sign that neurological function was more intact than anyone had realized. Elena immediately called for Dr. Chen, who began a more comprehensive neurological evaluation based on Elena's observations. Over the following hours, it became clear that the soldier's condition, while still critical, was not as hopeless as initially assessed. With proper treatment guided by Elena's insights, He had a chance of meaningful recovery. Nobody knew exactly what to call what Elena had done. The techniques she'd used weren't taught in medical school, weren't described in standard textbooks, weren't part of any official protocol, but they worked. The next morning, Colonel Danton addressed the entire medical staff. From now on, Elena's vital signs assessment techniques will be incorporated into our training curriculum. I don't need to know where she learned them. I just know we're fortunate to have access to her knowledge. Elena said nothing during the announcement. She simply nodded acknowledgement, then returned to her regular duties, replacing IV bags, adjusting ventilator tubing, maintaining the equipment that kept patients alive. But everyone understood that they were witnessing something remarkable, a person whose skills had been developed in places where conventional medicine couldn't reach, now using those skills to help people in ways that would never be publicly recognized. The soldier from Afghanistan made a full recovery. He never learned the name of the woman who'd identified the signs of neurological function that everyone else had missed. But he lived because someone with the right training had been in the right place at the right time, ready to see what others couldn't see. Elena continued working night shifts at Fort Pierce Military Hospital. Still anonymous, still unofficial, still invisible to most people who encountered her. But to the medical staff who worked alongside her, she'd become something irreplaceable. The person who remained calm when everyone else panicked, who saw possibilities when others saw only hopeless cases, who possessed knowledge that couldn't be learned from textbooks. The person who proved that sometimes the most important medical care is provided by people who don't need their names on diplomas. They just need steady hands and the understanding that someone's life depends on getting it right.
Subscribe if you believe the most skilled healers often work without recognition. They just know what to do when someone needs help, and everyone else has run out of options. Leave a comment and don't forget to subscribe to The Veteran's Story. We tell the stories that should never be forgotten. Real people are creating and telling stories, not mass-produced AI.